So Dr. Scholz, today we're talking again about prostatitis, and I have to apologize to our viewers. Obviously, we've covered prostatitis before, but there are so many different variables. And obviously, with its effect on PSA, I think we need to bring even more clarity to the situation. So my first question is, why does prostatitis matter in regards to prostate cancer?
Well, you sort of mentioned it with the allusion to PSA. So we rely on PSA so heavily for screening and tracking and diagnosing. And the wonderful thing would be if PSA only changed when the cancer changed. And sometimes people assume that's the case, and it's not. The PSA can jump around due to nonspecific inflammation from prostatitis, from big prostates, recent sexual activity, and I'd say prostatitis is the most confusing one. People understand how PSA can be high from non-cancer reasons when the prostate gets big, and of course that relates to the old PSA density calculations that we do all the time. The rule of thumb is that if you take the size of the prostate, which is measured with an ultrasound or an MRI, let's say it's 40 cc's, that's the average size prostate. The average PSA for someone with no cancer is going to be around 4. If their PSA's 8, but the prostate's 80 cc's, that's a normal PSA. So we're using the PSA for screening, and one patient aptly suggested, look at the PSA like a check engine light, and that it's not real precise, but it tells you if there's a problem. Well, when does a check engine light go on? It goes on when the PSA density is abnormal. That's when the 10-to-1 ratio I just described becomes 15-to-1. In other words, if a man has a 40 cc prostate, but the PSA is above 6, the check engine light just went on. And then we're talking about for screening or for active surveillance. We use PSA to try and determine if cancer is present, and we also try and detect higher grade cancers in men on active surveillance. But people shouldn't get concerned about their PSA if it's less than 1.5 of what we would expect. Now, the exception, of course, is that with prostatitis, that's inflammation of the prostate, you can see the PSA rise above that normal range. The check engine light is on. The PSA is higher than it should be for that size prostate, but it's not because of cancer. It's because of prostatitis. And that's why we're covering this today. The prostatitis conundrum is taking a really good test, PSA, and injecting a lot of confusion and muddying the water, and making it more difficult to use this tool, this wonderful PSA tool, due to the inflammation that can happen so frequently in men who are under monitoring conditions.
So you had mentioned that prostatitis is an infection of the prostate. First of all, can you expand on that a little bit? Like, how does one get an infection? And also, is it dangerous?
I tend to think of prostatitis in 2 categories. It's not one thing, but a chronic form that's not real well understood. It may be sort of an autoimmune thing like asthma or a skin rash like eczema. And it's causes inflammation in the gland. Probably the immune system is overactive. And then there's another type of prostatitis, bacterial prostatitis, an actual infection of the gland, like a urinary tract infection, and it responds to antibiotics. And oftentimes men feel ill when they get that type of acute prostatitis, bacterial prostatitis. So the chronic form oftentimes doesn't really have much of the way of symptoms, maybe some mild discomfort, maybe a little burning with urination that comes and goes. But the chronic form is very difficult to eradicate. People may try dietary things, herbal products, anti-inflammatories to try and reduce its impact, but and for the most part, I hate to be pessimistic, but it's not really curable. Whereas acute prostatitis, bacterial prostatitis, where someone might feel sick or feverish, does respond to antibiotics. That's less common and is generally fixable with antibiotics.
Thank you so much for watching. If you would like more information, you can visit our website at pcri.org. Also, don't forget to subscribe to our YouTube channel. We come out with new prostate cancer videos every week.